This patient education video was made possible thanks to the generous financial contribution of the St. Boniface Hospital Foundation and Richard and Joyce Brownscombe.
I was just not feeling well. I was short of breath. I was having some palpitations, or what felt like palpitations. I had very low exercise tolerance and very tired all the time, very tired.
Je retourne il y a 3 ans, l'année 2006. J'étais au lac et j'ai voulu faire de l'ouvrage un peu trop lourd pour moi. Je me suis senti étourdi et je suis tombé sur le Chesterfield, sur le sofa, presque sans connaissance, pas tout à fait. Et il y a une infirmière qui était de passage qui a pensé que je faisais une mini-stroke.
I started feeling some pain going up in my shoulders, and then it came back on quite strongly, the heartburn feeling, and I knew that there was something more seriously wrong than just heartburn.
Your heart is a muscle that pumps blood and oxygen to your body. Your heart beats between 60 and 100 times per minute. The heart is divided into 2 parts, the right and left sides. Each side has 2 chambers. The top chamber is called the atrium. The bottom is called the ventricle. Your heart also has 4 valves that act like doors. They open and close with each heartbeat. The main blood vessels of your heart are the right and left coronary arteries. These blood vessels bring blood and oxygen to your heart. The heart surgery you'll be having depends on your heart condition. 2 common heart surgeries are coronary artery bypass grafting and heart valve surgery. Coronary artery disease happens when the blood vessels of your heart are narrowed or blocked. This is caused by fat or cholesterol buildup in the heart's arteries, a condition called atherosclerosis. Coronary artery bypass grafting surgery allows blood to flow to your heart more normally, whereas before, blood flow was limited. A bypass is made for your blood to go around a narrowed or blocked artery. A blood vessel from your leg, your chest, or your arm is used to make this bypass. You may need more than 1 bypass. Repair or replacement of a valve is done when a heart valve is not working properly. When a valve is replaced, a mechanical or tissue valve can be used. You and your surgeon will discuss what type of valve is right for you. Once you have been accepted for surgery by your heart surgeon, your health information will be sent to the cardiac surgery coordinator's office. You will get an information package at your clinic appointment or by mail. This package will give you information about your surgery, a phone number for the coordinator's office, and a booklet called The Patient's Guide to Heart Surgery. Please call the coordinator's office when you get this package. The coordinator will want to know if there is any change in your medications, in how you are feeling, or if you have concerns about the timing of your surgery. The coordinator will let your surgeon know about changes in how you are feeling. You will be given a date for your surgery from this office. It is important you stay in contact with the coordinator until you have your heart surgery. This is the time to plan ahead for going home. You can expect to stay in hospital for a few days after your surgery. Someone will need to drive you on errands and for appointments. You will need help with heavier household chores. If you have concerns, talk to hospital staff about help that may be available to you.
The hardest thing for me was, having to ask for help. and realizing, like, you have to do it. You have to ask people for help because you can't do this.
You will be seen in the cardiac pre-assessment clinic. Your medical history will be reviewed. You will have a physical exam. Tests will be done, such as a chest X-ray, blood tests, and an EKG. You will be given information about your surgery, pain management, and your recovery. You'll also be told where and when to report to the hospital. You'll be told how long you need to fast and which pills to take before your surgery.
All your regular medications you can take up until the day of your surgery.
Okay.
There is a chance that the date of your surgery may change. If this happens, the hospital staff will notify you as early as possible.
I think the worst part of the whole experience was waiting to get the call for your date of surgery, and then the night before is always stressful. It's difficult to get to sleep, and you're worried about how things are going to go the next day, and you worry about how things are going to be at home. How's the family going to manage while I was away, and that sort of thing.
I didn't suffer anxiety about that. I knew what had to be done. And if I didn't have it done, I knew that, living with angina, living with significant coronary artery disease and having a long history of this, and knowing how that can incapacitate people, I said, I remember telling the surgeon, I said, when you go in there, make sure that you find all the occlusions. Because I'm only giving you one chance, I said.
On the day of your surgery, the hospital staff will help you get ready. Don't bring valuables with you to the hospital, but do bring your patient guide to heart surgery booklet. Hospital staff will use this booklet to go over your care after surgery. The hair from where you will have the surgery will be removed with clippers. Don't shave this hair yourself. An intravenous will be started. In the operating room, you'll see the surgical team. The staff may give you medicine to help you relax. After you're asleep from the anesthetic medicine, a breathing tube will be put in. Your surgery may take 3 to 5 hours. Operating room staff will update your family in the waiting room during your surgery.
The initial feeling was, it's over. It's interesting, prior to the operation, you have to go to a clinic, and they explain to you in full form that when you wake up, you're going to be full of wires, things sticking out of you. So it wasn't much of a surprise. Of course, I was all doped up.
After surgery, you'll be moved to the intensive care unit. When you wake up, you'll hear noises from the machines around you. You may have a breathing tube in your throat. Other tubes you may see are intravenous lines, a tube in your bladder to drain your urine, tubes in your chest to drain fluid from around your heart and lungs, pacing wires, and a heart monitor. The healthcare team will ensure you are getting the proper care for your recovery. After surgery, you'll feel some pain around your chest incision. If you had coronary artery bypass surgery, your arm or leg may also be sore. Do not try to stand the pain. Your nurse will give you pain medication as often as needed. You may feel sick to your stomach after surgery. If you are, let your nurse know. You'll need time to recover. In intensive care, close family can visit, 2 people at a time. Hospital staff will help you sit on the side of the bed. The next step will be sitting up in a chair. It is important for you to work with hospital staff during your recovery. You'll need to deep breathe and cough while awake to keep your lungs clear.
When they want you to cough or want you to move, you move. And they were very good at helping you because movement was not exactly enjoyable. There was a fair bit of discomfort, and you certainly natural instinct is to guard and not to do these things. But they, the nursing staff and the support staff were persistent, but very, what should I say, empathetic. I felt by and large everybody's attitude was, yeah, we know this is uncomfortable, and we'll try and help you make you do it, but you've got to do it. And so they were very encouraging, but didn't let you persuade them that it wasn't a good idea.
When you're ready, you'll be moved to the ward. Your heart will continue to be monitored. You may have pacing wires in after your surgery. These will be removed before you go home. You may still have tubes in your chest to drain fluid around your heart and lungs. Once these tubes are removed, a dressing will be applied. Your incision from the surgery will be covered with a dressing. When it is time, the dressing will be removed. The tube in your bladder will be removed shortly after your surgery. Once it's removed, you can go to the bathroom to pass your urine. Constipation is common after surgery. There is medication you can get to relieve this. Walking and eating a high-fiber diet will also help. A blood vessel from one of your legs may be used if you've had coronary artery bypass surgery. Your leg may be swollen for up to 3 months after your surgery. Putting your leg on a pillow when lying down will help. You may feel sad, anxious, or depressed after your heart surgery. It's perfectly normal to feel this way.
The physical body will heal, but the mind is what you really got to work on. You really have to convince yourself that, look, I can be a new person again, with a repaired heart. I mean, that's okay, and get your mind around that, and that a lot of the healing of the mind and of the body has to do with what we do afterwards.
I took the advice of the doctors and the nursing staff and exercised when they told me to exercise, walked when I knew I should walk. I did the breathing exercises, which is really important. I found later that they really helped a lot.
Take your pain medication regularly to make it easier to get moving. Staff will help you walk. Let your nurse know if you're having pain. As you gain strength, you'll begin to walk on your own. Start with a short walk and increase your distance slowly. Take rest breaks when tired. Your family and friends are welcome to visit you, but keep in mind there is a 2-hour rest period with no visiting each day to help you with your recovery.
So if at rest your pulse is 60, when you exercise it.
Physiotherapy will review exercises and a home walking program with you. Usually during heart surgery, your breastbone has been cut. You may feel a clicking in your chest with some activities. If this happens, stop the activity. Don't put stress on your breastbone for 6 to 8 weeks. That means no pushing, pulling, or lifting anything more than 5 to 10 pounds.
Nothing overnight, so you just have a breakfast, lunch, supper, bedtime.
Before you leave the hospital, you'll be given a prescription. The pharmacist or nurse will go over your pills with you. If you had heart valve surgery or an irregular heartbeat, you may need to take a special blood thinner pill. Taking this pill will require you to get your blood checked regularly. You'll be told how to take this pill and when to see your healthcare provider. The Cardiac Rehabilitation Program is the best way to help you recover after heart surgery. Become heart healthy and slowly increase your activity. When you attend cardiac rehabilitation, you'll find out more about complications, risk factors, medications, healthy lifestyle, emotions, and exercise.
You know, after I went to wellness center, that's what I figure brought me out of like being sitting down all the time and kind of, you're being scared to move and that. But the wellness center, I just really think that was a key.
The cardiac rehabilitation program is offered in Winnipeg at the Refit Center or the Wellness Institute at Seven Oaks General Hospital. If you live outside of Winnipeg, you may be able to follow a modified cardiac rehabilitation program and, where services are available, access help within your own community.
Mais ils m'ont donné une vidéo de faire des exercices et puis ils m'ont recommandé d'aller au Refit Center. J'ai pas besoin de ça, mais c'est la meilleure chose que j'ai faite. Moi, je dirais à tout le monde qui a dommage avec le cœur d'aller au Refit Center. Ça m'a aidé beaucoup.
As your body heals, feelings of anxiety or depression should begin to disappear. If these feelings don't go away after a few weeks or interfere with daily life, ask for help from your doctor, psychologist, counselor, or a spiritual care advisor. It may take up to 6 months to feel like yourself again. There are other things you can do to help with your recovery. First, there is a strong link between smoking and heart disease. So if you smoke, quit. Second, regular exercise is good for your heart and good for you. Your goal should be 30 minutes of activity most days of the week. And finally, a balanced diet helps control both cholesterol and weight. Limit high-fat foods and follow the Canada Food Guide.
Mon problème était surtout la partie héréditaire. Et puis, quand ça vient de la partie héréditaire, il n'y a pas grand-chose que tu peux faire. Le commentaire de Dr. Pascoe était tout simplement « Your family history caught up with you ». Alors, dans mon cas, c'est certainement ça. Et puis, le deuxième facteur, c'était ma diète. C'est que j'ai fait des changements assez drastiques dans la diète. Je fais beaucoup plus attention. Aucun sel, beaucoup plus de verdure, de laitue, etc.
When your doctor tells you you need an operation on your heart, your first reaction might be fear. It shouldn't be. Because what your doctor is really saying is you're going to have your life back.
J'ai eu 4 pontages, puis une valve. Hein? Donc, quand on me parlait de ça, c'était quelque chose d'assez conséquent quand même, assez gros. Et à mon âge, tout ça, je me trouve extrêmement chanceux d'avoir... Je remercie ceux de la santé qui se sont occupés de moi, ils ont fait du bon travail.
The walking that I was supposed to be doing for my own good was rough, because that was not so good. But I did it, and here I am. I'm here, I'm alive, it's wonderful.
If you are watching me now and you're preparing for heart bypass or heart surgery, I'm going to tell you, don't worry. Good luck.